Hey everyone, it's Erica B from Beyond the Bump, and I wanted to, first of all, just thank everybody who reached out to me from my last post with our baby practice breathing. Um, yeah, it was pretty wild to just watch him inside of me and breathing. It was weird. But everybody also who reached out to me about my poor puffy feet, I did get some feedback that other people who follow me had some swelling or a lot of swelling in their pregnancy, and I kind of want to explain why that happens. Of course, it can happen for a number of reasons, so please don't think that this is the end all be all answer for that question or for that topic. For for most pregnancies, it's just the end of a pregnancy and gravity pulling your blood down. So the veins that push your blood back towards your heart aren't as strong as the arteries that push your blood away from your heart. So you get what's called pooling, where the blood stops at your feet just from gravity, and those veins are working extra hard to get that fluid back towards your heart. And so that can take a little bit longer, so you end up with some swelling. In my case, and in the case of women with high blood pressure, pre-eclampsia, HELP syndrome, things like that, we have a little bit of a different issue. Now, sometimes it can still be just that normal swelling, but also it can be from our bodies getting sick. So I use what's called a rice strainer, and I'm making that up, of course, a rice strainer analogy. So if you think about a rice strainer in your body, your kidneys are that strainer. Your kidney's job is to filter out everything that, of course, comes out of your body as urine. And there are a lot of particles that should stay and be too big to fit in that strainer, like the rice. So if you're making rice, you don't want the rice going through the holes of the strainer. That means your strainer holes are too big. So in my case, and in the case of many women with preeclampsia, hypertension, things like that, what'll happen is we will start to spill protein through our rice strainer, our kidneys. Your kidneys are supposed to keep your protein in your bloodstream, in your body, and you're not supposed to be peeing that out. So what can happen is, because your pressure is so high, like mine was when I showed up back to the hospital after having my son, it was 194 over 123. That is really high. Anything that is 160 on the top number or 110 on the bottom number or greater, either of those numbers, is considered severe range. So mine was really, really high. 190s over 130s is extremely high, which put me at risk for strokes and seizures and all kinds of stuff. So with that being said, the pressure can put a strain, like it can make the holes of your kidneys or your rice strainer bigger, because you're putting extra pressure and those holes just start to get bigger and bigger and bigger, allowing for larger particles to come out. Now, for the most part, it ends up being protein that you start to, what we call, spill into your urine. Why does this matter? It matters because protein's job in your body is to keep your fluid inside your blood vessels and not out in your tissue, which shows up as swelling. So when you start to pee out protein, usually as a labor and delivery nurse, we can tell because you're really, really puffy. Now, it starts with just the feet, might go up to your knees, might go up to your abdomen even. It might go up to your hands, like where your hands are really tight, rings aren't fitting. You might have symptoms of like carpal tunnel, where the nerves in your wrists are really angry, and so that's extra pressure on those nerves. And then you could have swelling in your feet. In your face. So that's usually the last sign. The problem is, I typically, as a labor and delivery nurse, do not know what you looked like before you came to see me. So we have to kind of take your word for it. So that's something that we need you to watch and family members to watch. So back to my protein spilling in my urine, causing my swelling. That's the typical reason why the swelling happens if you have any type of increasing blood pressure. It doesn't have to make it to where mine made it to. But if your blood pressure is increasing and you start to notice that swelling, then that could be a sign that your blood pressure is too high, even if it's just too high for you and your baby. Some babies are used to 90 over 50. Some babies are used to 130 over 80. Some babies are used to 150 over 80. It all just depends on what your body and your baby are used to as to how well you'll tolerate that. If you have a significant shift or increase in that pressure, then you can start to see this type of swelling that you'll see. I'll post some pictures of my poor helpless feet from last time where you could literally leave your fingerprints on my feet just by touching them, and they were painful to the touch. So I hope this answers the questions about the swelling. I promise I'm watching mine. I promise my blood pressure was halfway decent when I went for my NST today, which is the video that you saw of my kiddo breathing inside my belly, and we will be monitoring that further. Please post any comments, questions, concerns below in the comment section, and follow my YouTube page, Beyond the Bump. Thanks.